Good evening and thanks for joining us. It is September 8th. That means we've been in this pandemic for 7 months now, and it means fall and winter are approaching. COVID-19 is going nowhere. In some parts of Canada, the virus is now spreading faster than it was over the summer, and that has set off alarm bells. As students head back to school, Canada's top doctor is urging Canadians to get back to public health basics.
Although Canada is striving to maintain a slow burn, the average daily case counts has been increasing in recent days. This is concerning. Now is not the time for complacency.
New infections were reported across Canada today, though the areas of greatest concern are the 4 biggest provinces: British Columbia, Alberta, Ontario, and Quebec. Today, there were 83 new cases in BC, 157 in Alberta, 163 in Quebec, and 185 in Ontario. And in Ontario, officials are so concerned about the uptick in cases, they've paused any further easing of restrictions for 4 weeks. The health minister says that means no changes to the size of social circles or public gatherings allowed in Ontario. Today, the premier pleaded again for people to be responsible and report bad behavior if they see it.
Because it's pretty simple. Just follow the guidelines. Don't have these big parties. Don't have these big family gatherings. It is simple. And I encourage the neighbors, if you hear the big parties, call the police. And I'm asking the police, go in there and lay charges. Very, very simple. We have to start putting the hammer down on people that don't want to follow protocols and guidelines.
The message is play by the rules now, because if you don't, tighter public health restrictions will return. In BC, that's happening now. Provincial Health Officer Dr. Bonnie Henry has ordered all nightclubs and banquet halls to close immediately. Bars and restaurants can no longer serve alcohol after 10 p.m. and they must close by 11.
As we get back to work for many people and back to school for many people, it is the time for all of us to cut back on our social interactions.
There are going to be challenges ahead. We have 2 reports tonight, beginning with Eric Sorensen.
It's a convergence that is worrying public health officials and governments across the country. Just as schools are reopening, COVID-19 case numbers are rising. In Ontario, close to 400 new cases the last 2 days.
On this, the first day of school for many young Ontarians across the province, we need to do everything we can to limit the spread of COVID-19.
But after a spring of near total lockdown and a summer of greater social interaction, now comes a new test. Can children return to classrooms and not create a second wave in the pandemic?
School can be a source of transmission. And I think that our bigger concern also is looking at the colder months, where people are going to tend to huddle indoors, and all of these things can contribute to increased transmission.
Already national numbers are rising, particularly in the West. British Columbia reported an average of fewer than 20 cases per day from mid-May to mid-July. It's risen to an average of about 80 cases a day in late August, early September. The graph shows a similar rise in cases in Alberta. Manitoba saw a recent burst in case numbers. Ontario and Quebec are rising, but not as dramatically as in the West. On the East Coast, case numbers remain low. Nova Scotia, for example, averaged less than 1 case per day for weeks. The overall national pictures, the 3rd week of August, an average of 390 reported cases per day across the country. The following week, 435 cases per day. Into the 1st week of September, an average of 545 cases daily, a 25% increase over the week before.
This week, I think, is a really critical week, and for sure next week, because then you would have had some idea of what happens when you go back to school. So the next couple of weeks is 2 weeks of careful vigilance.
One big advantage in dealing with COVID-19 now, it's being monitored much more effectively than it was last March.
Because we are looking at the numbers and the trends so closely, we're actually seeing the wave as it's developing. And that way we can do more focused lockdown and focused interventions to try to keep these small fires from becoming a big one.
Young people are less likely to get seriously ill from COVID-19, but it is a massive social and epidemiological experiment, putting children back in schools without putting themselves or other more vulnerable Canadians at risk. Eric Sorensen, Global News, Toronto.
Nervous, Betty? Anxiety on the first day of school is normal, but in this new normal, nothing is as it was.
It's a whole nother world in there.
It's been 6 months since students last saw the inside of a classroom. In Pickering, Ontario, the Youngs practice what to do in lieu of hugging their friends.
elbow.
You can do the elbow.
and had long talks about staying safe and the importance of masks.
It's going to be hard because I'm going to have to maybe go to the side and do this because I might not be able to breathe, and it's going to be very hard to just wear a mask in school.
But she says she'll do it because we've seen a flurry of cases at schools across the country. After a single positive test, 100 students were sent home from an Edmonton high school. And in Ottawa, 200 staff and students are now in quarantine after possibly being exposed to a number of cases on school buses. While concerning, health officials say neither story is unexpected. A big danger right now, they warn, is overreacting and creating anxiety for our kids.
When we know that students are too anxious, then learning stops. The brain actually starts to reconfigure itself into the fight or flight. If there's too much anxiety, the child's not going to learn. They look very distracted all the time, or they become very drawn in. They freeze. They're very quiet.
Balancing safety and education has never been more complicated. And it all starts with how we drop our kids off at school. Mike Drolet, Global News, Toronto.